I will be explaining the process for collecting a swab that needs to be done in full PPE, such as COVID-19 testing or a strep swab, outside of the emergency room. This is not an emergency room visit. This is just an outpatient lab. But due to the PPE that is required, we will be doing it under the awning outside of the emergency room. So prior to testing, Public Health Solutions will identify a patient that needs COVID-19 testing that is not able to go to the drive-thru or is more urgent. They will get the name and number of the patient. They will call myself or Tara and notify us of the patient that's needing the testing done. Myself or Tara will then contact the patient with instructions and screening questions. We will also set a time with that patient to figure out when it will work for testing. Myself or Tara will then notify patient access, requesting a time of testing. The patient access staff will then call the patient and let them know what time their scheduled test is and put them on the lab schedule. In the notes for this, patient access will say COVID-19 in the scheduling notes. They will also obtain and verify demographic information and make any updates as they are necessary. They will then provide instructions to the patient that when they come to the facility to drive around back to the hospital to the emergency room entrance and pull up under the awning. They will tell the patient to stay in their vehicle and wait for the nurse to approach their vehicle and wait for instructions. I will have also told the patient to bring an insurance card and an ID if they have one. I will have also, or Tara, have called lab and asked lab to put the order in the computer. We will then advise lab which tests to run, whether it's through NPHL or LabCorp. We are currently utilizing Dr. Ebke for a verbal order format for all of these orders. Lab personnel will check in the patient and answer the COVID screening question. This is why Brittany or Tara would have asked them before to give them the form with all of their answers. LabCorp tests will go shipping between or at 1 o'clock or at 9 o'clock. NPHL tests will either go at 5 o'clock to then be sent to Bryan West to wait for the courier there, or have a stat courier through RPS. This will be at the discretion of the health department. So you put on your bunny suit, and you can either put the hood up over your head or have somebody tuck your hood in for you. And then you will put on your PAPR belt and PAPR hood. It is important to wear a mask underneath so that when you take off the PAPR, you still have some sort of respiratory protection. For the reusable PAPRs, it is okay to wear a surgical mask, like this one. For the disposable PAPR hoods, those ones need to have an N95 underneath of them. You will then turn on your PAPR and make sure that it is working appropriately. The assistant person will put on eye protection, and they will change out their regular surgical mask for an N95 mask. They'll make sure it covers their nose and mouth and pinch it off really good. Take a deep breath in and out to make sure there's no air coming, and then they will put on their eye protection. We will tell the patient to make sure they back up and are between the lines that are on the side of the building, the white striped lines. This will be perfect. See how we can see the lines? Just make sure they are backed up far enough. The primary nurse will go up to the patient's car with a plastic bag and ask that the patient drop in their ID and insurance card. The primary nurse will then seal that and hand that to the secondary nurse. The secondary nurse will take that inside the facility and make a copy, front and back, of both ID and insurance card. The secondary nurse then hands the bag back to the primary nurse, who gives it to the patient. The patient then keeps the bag and the cards. The primary nurse is then given the swab kit. The primary nurse opens the swab kit and obtains a nasopharyngeal swab of the patient. She then makes sure she puts the swab into the solution and seals the lid. Depending on the swab you use, you may have to bend the swab stick. She then drops the sample directly into a biohazard bag that is sealed by the secondary nurse. The secondary nurse will then take the sample inside the building. That is where lab or another person will be waiting with another clean sample bag to place the sample in without touching anyone. The nurse will then talk with the patient to let her know that her test results will be called to her within the next 2 to 3 days. They will also tell the patient that she is to go home and self-quarantine, meaning do not hang out with anybody. If you can stay in a separate room, that is ideal. And use your own bathroom, just by yourself. If you are needing emergency medical care, please call the hospital before you show up. That way we can prepare for your arrival.
Go to Walmart first.
Somebody will help you by doing hand hygiene with the spray alcohol hand sanitizer. They will then hand you a green Oxicide rag that has been dipped in the solution. The primary nurse will then wipe from her elbows down. And then they will put the dirty rag in the dirty linen bucket. They will remove their gloves and throw them in the trash can. And then put hand sanitizer on. And then a new pair of gloves. This is the process that we will use if we are going to be doing multiple drive-up swabs, one after another. Now, once she has her gloves on, she is ready to do the drive-up process for the next patient. Hand hygiene will be performed with the alcohol-based hand sanitizer, a green rag with the Oxicide solution that is damp will be given to the primary nurse to wash her entire body and her hood. Starting with her hood of her PAPR, she will then take the hood off and hand it to the secondary nurse, and then she will wipe off the hose and the PAPR machine. The secondary nurse will take the PAPR machine from her and make sure it is turned off as the primary nurse continues to wipe off her entire body. The secondary nurse will take another rag and wipe off the backside of the primary nurse. Please note that the primary nurse still has a surgical mask on. This is to protect her from any other respiratory illness. Once the entire suit has been wiped off, the primary nurse can then enter the building and doff her gown, her bunny suit. Please note that at any other time, the primary nurse is not to enter the building, even in the entryway, until she has been properly decontaminated. After she has doffed her bunny suit, she will then do proper hand hygiene after removing her gloves. Thanks for tuning in, and as always, call me with questions.